Let's start with the basics. Deep inside your tummy, connected to your large intestine, is a small, finger-shaped pouch called the appendix. For years, doctors thought it was useless, but now we think it might help store good gut bacteria. Most of the time, you don't even notice it's there. But when it gets blocked, trouble starts. This is appendicitis. Appendicitis means your appendix is swollen, inflamed, and filled with pus. The blockage traps bacteria, causing pressure, swelling, and infection. Think of your appendix like a balloon with one opening. If it gets plugged, things back up fast. The infection can quickly cut off blood supply, making the tissue die and increasing the risk of bursting. If the appendix bursts, pus and bacteria spill into your abdomen, causing a dangerous infection. That's why appendicitis is a medical emergency. It won't get better on its own and needs quick treatment. Knowing the signs can help you act before it gets serious. Let's look at how to spot it early. Most cases are acute appendicitis, sudden, severe, and a true emergency. The pain starts dull, then becomes sharp and focused in hours. Acute appendicitis almost always means a trip to the hospital for surgery. There's also chronic appendicitis, which is rare. Chronic means long-lasting with milder symptoms that come and go. It's often mistaken for other tummy troubles and is hard to diagnose. The cause is usually a partial blockage, so symptoms flare up and settle down. Chronic cases can turn acute if the blockage worsens. Treatment for both is usually surgery to remove the appendix. Once it's gone, the pain stops. Acute is a sprint, chronic is a slow, frustrating marathon. The classic symptom is tummy pain, but it follows a pattern. It usually starts as a dull ache near the belly button. Over hours, the pain moves to the lower right side and becomes sharp and constant. You can often point to the exact spot. This is called McBurney's point. The pain gets worse with movement, coughing, or even deep breaths. Many people want to lie still to avoid making it worse. Pressing on the area hurts, and releasing the pressure can make it hurt even more. This is rebound tenderness. Not everyone has the classic pain migration, but if you do, it's a big clue. If pain starts in the middle and settles in the lower right, take it seriously. Don't wait it out. This pain is your body's warning. Early action is key. Let's see what other symptoms can help confirm appendicitis. Besides pain, appendicitis brings other symptoms. Loss of appetite is common, food just doesn't appeal. Nausea and sometimes vomiting usually follow the pain. Vomiting before pain is less likely to be appendicitis. A low-grade fever often appears, but a high fever may mean the appendix has burst. Chills and shivering can happen as your body fights infection. Changes in bowel habits, constipation, trouble passing gas, or sometimes diarrhea may occur. The tummy might look swollen or bloated. These symptoms can be confusing as they overlap with other conditions. But when combined with classic pain, they point to appendicitis. It's the collection of symptoms that matters. If you notice these together, seek help. Don't ignore the warning signs. If you suspect appendicitis, there are a few checks you can try, but these are not a substitute for seeing a doctor. Lie on your back and gently press the lower right abdomen. Sharp pain is a warning. Try the rebound tenderness test press and quickly release. Worse pain on release is a red flag. Cough or jump if that triggers sharp pain in the same spot, be concerned. The heel drop test, rise on tiptoes. Drop your heels, pain here is another sign. These checks are just for information. If they cause pain or if you have several symptoms, don't delay. Go to a doctor or emergency room right away. Don't eat, drink, or take painkillers. They can mask symptoms and complicate diagnosis. Appendicitis is a true emergency. Time is critical. Let professionals take over. Your safety comes first. Many conditions mimic appendicitis, so a doctor's evaluation is vital. Stomach bugs cause pain, nausea, and diarrhea, but pain is usually all over, not focused. In women, ovarian cysts, ectopic pregnancy, or pelvic infections can look similar. Urinary tract infections and kidney stones also cause lower belly pain. Kidney stone pain comes in waves, unlike the steady pain of appendicitis. Digestive issues like Crohn's disease or diverticulitis can also confuse things. Even severe constipation can cause pain. Doctors use exams and tests to sort out the real cause. Don't try to self-diagnose. Let the experts figure it out. Appendicitis almost always starts with a blockage at the appendix's entrance. The most common cause is a small, hard piece of stool called a fecalith. This acts like a cork, trapping bacteria and causing infection. In children and young adults, swollen immune tissue can block the opening. Sometimes infections elsewhere in the body trigger this swelling. Rare causes include worms, tumors, or even trauma. Often the exact cause isn't found. It's not your fault. Appendicitis is a random event. Anyone can get it, regardless of lifestyle. The key is recognizing it early. Is appendicitis genetic? There's a slight family link, but most cases happen randomly. Stress doesn't cause appendicitis, though it can affect your immune system. The real problem is a physical blockage, not emotions. Diet may play a small role. Low-fiber diets might increase risk, but it's not proven. High-fiber diets are good for gut health, but don't guarantee protection. Most people with appendicitis have no family history or obvious risk factors. It's not hereditary, not caused by stress, and only loosely linked to diet. Anyone at any age can get it. It's mostly bad luck. Focus on recognizing symptoms, not blaming yourself. Delaying treatment for appendicitis is dangerous. The biggest risk is a ruptured appendix which spills infection into your abdomen. This causes peritonitis, a life-threatening infection of the abdominal lining. Symptoms become severe intense pain, rigid belly, high fever. Peritonitis can lead to sepsis, organ failure, and even death. Another risk is an abscess, a pocket of pus that forms around the appendix. Abscesses need to be drained before surgery can be done safely. Recovery is much harder after complications. Early treatment prevents these dangers. Don't wait. Act fast if you suspect appendicitis. At the hospital, doctors start with questions about your symptoms and a physical exam. They check for tenderness and rebound pain in your lower right abdomen. Blood tests look for infection. Urine tests rule out other causes. Women may get a pregnancy test to exclude ectopic pregnancy. Imaging, ultrasound or CT scan, helps confirm the diagnosis. Once appendicitis is confirmed, surgery is almost always needed. The operation is called an appendectomy. It's one of the most common emergency surgeries. The goal is to remove the appendix before it bursts. Sometimes antibiotics are tried first in mild cases, but surgery is the gold standard. The decision to operate is made quickly. Fast action saves lives. Appendectomy can be done as open surgery or more often laparoscopically with small cuts. Keyhole surgery means less pain, smaller scars, and faster recovery. After surgery, you'll spend a short time in the hospital, longer if the appendix burst. You'll start with fluids, then move to solid food as you recover. Walking soon after surgery helps prevent complications. If your appendix burst, recovery is longer and may involve antibiotics and wound care. At home, take it easy and avoid heavy lifting for a few weeks. Most people return to normal activities in 1 to 4 weeks depending on the surgery. You don't need to change your diet or lifestyle. Life without an appendix is completely normal. The body functions just fine without it. Focus on healing and follow your doctor's advice. If you have persistent worsening pain in your lower right abdomen, seek medical help immediately. Don't try to tough it out or wait for it to pass. Early treatment is crucial. Appendicitis only gets worse with time. Go to the emergency room or call for help if the pain is severe. Don't eat, drink, or take medication while waiting for help. Doctors would rather check you and find nothing than miss a dangerous case. Trust your instincts. If something feels wrong, act on it. The outcome is excellent when treated early. Delays lead to complications. Listen to your body and get checked out. It could save your life.